and welcome to Ray's Financial Literacy Workshop, specializing in financial management on medical expenses. Deepika has packed the panel today with the top experts in their field. You do not want to miss this episode. Our first distinguished panelist is Dr. Mehta. He is a board-certified psychiatrist practicing medicine here in Charlotte, North Carolina since 1979. Currently, he practices at Piedmont Psychiatric Association. He is the founding father of the North Carolina chapter of the American Association of Indian Origin, AAPI, where he continues to be a leader. He has led many psychiatric facilities as a medical director, and we are honored to have him as a Raise Global Foundation board member. Thank you. Next, we have Representative John Autry, who has dedicated his life to shaping public policy. Representative Autry served as Soil and Water Supervisor, a city council member, and now he's currently in the House of Representatives, House 100. And I have his badge on me today. Representative Autry serves to make the world a better place for his grandchildren. Last on our panel is Dr. George Boumfaut, a retired neurosurgeon. As a neurosurgeon, Dr. Boumfaut was tired of insurance agencies blocking his ability to treat his patients. Due to this injustice, he joined the Board of Healthcare Justice NC and is fearlessly a fearless champion trying to make healthcare a human right through public opinion. Before we start, I want to take a minute to talk about Deepika Dave and her leadership with Raise this past year. This will be her 8th financial literacy workshop Deepika has spearheaded. She became the founder and the president of Raise because she knows that young adults must learn financial literacy to become successful in the world. She graciously teaches all young adults for free. Most impressively, when COVID-19 started back in March, Deepika mobilized her volunteers and started producing CDC quality masks. Over 1,800 masks were distributed to India, North Carolina, and South Carolina, even before our federal government acknowledged we needed masks. Words cannot express my gratitude because of all the lives she has saved. Deepika did not ask for money. She gave them away free so we as a community could survive this pandemic. Deepika, thank you for your courageous leadership. I also want to tell you that Deepika has a structural engineering degree from UNC Charlotte. She is an engineer that created a nonprofit. Deepika, would you like to say a few words about Raise before we start with our distinguished guests?
Sure. Thank you, Tara, for the nice introduction for everyone. Hello, everyone. Welcome and thank you to our valuable guest speakers, Dr. Praful Mehta, Representative John Autry, Dr. George Boumfaut, and all our participants for joining us tonight for this event of the Financial Management on Medical Expenses from Raise. We are proud and privileged today to have you all in this session. Hope everyone is safe and doing well. I am Deepika Dave, the founder and president at Rising Ambitions of Young Society. I'm extremely proud to have founded the Raise Global Foundation, a 501c3 nonprofit organization, in May 2019 to educate, engage, and empower young generation. Raise has primary mission of providing a support network focusing on delivering programs to enhance financial literacy, drug awareness, and women empowerment in the USA and India. Hundreds of girls, boys, women, and men have benefited from our programs and campaigns on gender equality and women empowerment in India. We do not only make women aware, men too. Rays believe that women and men complement each other and do not compete. Their difference is not a problem, it's a solution. We provided employment to 30 women in India last year and would continue to do the same in coming years. We provide free tuition to kids in slum area in India who are underprivileged and marginalized. Because we could not hold in-person workshops in 2019 during this pandemic time, we provide valuable information on different topics of financial literacy and women empowerment via webinars and online meetings in the USA and India. With financial literacy as our charter program, our mission is to empower young people during a critical development period of their lives. Raise hopes to instill positive habits on savings, investing, and consumption. Money skills are one of the best things we can give to our children. It will set them up for a better future and a future of independence. So the workshops Raise provide on financial literacy have a highly defined purpose to promote financial awareness and stability in the young people's lives. Raise Global Foundation has a very deep insight for the younger generation to help succeed in their social, cultural, financial life and live a successful, peaceful, purposeful, and successful life. Let's see what and how medical expenses impact everyone and how important is it to manage your finances in the context of medical expenses in your life. The economic downturn caused by coronavirus pandemic has renewed attention on health insurance coverage as millions have lost their jobs and potentially their health coverage. Following ACA, the Affordable Care Act, the number of uninsured non-elderly Americans increased for 3 straight years, growing by 2.2 million from 2016 to 2019. Let's look at more statistics. How many people are uninsured? For the third year in a row, the number of uninsured increased in 2019. Almost 28.9 million non-elderly individuals were uninsured in 2019, and an increase of more than 1 million from 2018. Why are people uninsured? So in 2019, 73.7% uninsured adults said that they were uninsured because the cost of coverage was too high. Many people do not have access to coverage through a job, and some people, particularly poor adults, were uninsured. Why is insurance so costly in the US, and how should people manage their finances to handle health crises? Let's learn from Dr. Mehta, who has treated thousands of patients. He works with many families and he has first-hand knowledge and awareness as to perils of non-management or inadequate management of their medical illness, which results in financial ruins, loss of homes, bankruptcies, even suicide. Dr. Mehta, please.
Thank you. Good evening to everyone. I want to thank Deepika Dave and Raise Global Foundation to allow us to come on the video and give our opinion and discuss this very vital, important subject of management of medical expenses. She previously arranged the literacy seminars on other issues, but this is also equally important. I want to thank the Raise Foundation for doing so. Very first thing I want to clarify is my talk will be basically pertaining to the situation before COVID-19. As we all know, USA and the world countries are involved in a very serious catastrophic medical condition, which will have a everlasting medical expense challenges going into decades. But I'm not talking of that. There's something different. Secondly, talking about management of payment of the medical bills in the USA and not other countries, because most of the audience, I believe, will be in USA. With this clarification, let me go on. The management elements basically have issues connected to who are the players, clarification and clear vision as to what is the issue at hand, also the assets, the liabilities, what are the players, what are the reasons behind the subject matter. We talked about it. When we talk about the paying the medical bill, basically we are talking of two managers. One is the person who is having to pay the, and is our government, who has some responsibility to provide the medical care to the population at large. Somebody would ask, so these are the two players who need to think about how they manage paying the medical bills on a routine, month-to-month, day-to-day basis, like a routine care, as well as the care when it comes to serious medical crisis, which results into very huge medical bills, which are not paid by the insurance and whatnot. And of course, there's a large population who do not have any insurance in the USA even now. So somebody will ask, do we have a medical payment crisis? One would say yes. And the reason being, we have a huge population uninsured, and somebody has to pay for those people's services. And the people who have insurance carry the burden of the paying for those individuals. And every month, the number of people who are uninsured or semi-insured or inadequately insured is going up. USA spends a huge amount of money for the medical care. For example, the medical budget for the USA is a $3.6 trillion, which is a huge chunk of the medical bills the government has to pay. And it is over increasing. By the 2026, the medical care budget for the government will increase to 5.46. So you can see the cost of the care for the medically ill patients is growing very rapidly, much faster than the cost of living, from 2.1 to 3.5. USA spends a huge amount of money, but the outcome is not as promising and as good. However, we don't have some universal, some ongoing solution for these issues. Our US system operates in a very different way compared to some other countries. We are talking of way to compare our country is with the developing countries like Scandinavian countries or Western European countries. We cannot compare ourselves with the developing countries like Asian countries or countries which have a different way of political system. We are democratic, and that's what we are talking about. Even comparing US system with the Scandinavian, we don't seem to be doing that well. We spend about $11,000 per person per year on the medical bill, every individual, $11,000. Compared to that, Canada, which has a democratic system but different kind of system, they have a socialistic system, they spend about 1/2 of what we are spending. The outcome measures are better or equally good. The satisfaction rate for those countries much better than our satisfaction rate in USA. You ask people in USA, doctors, hospital, healthcare providers, nursing staff, they would have some degree of dissatisfaction with our system. Everybody would say our system is broken, fragmented. We are not doing as good. So considering this, let's understand why it is that way. Even though we spend so much money, our huge budget goes to the healthcare provision, why our outcome, why our satisfaction is so low. The fundamental issue here is pricing. Ours is one of the most expensive medical care anywhere in the world, okay? And there are a number of reasons why the prices are so high. We're going to go to that other. We have a less emphasis on the preventive and alternative care. We don't spend enough time and attention to preventive methods, which saves lots of money. Preventing the disease, prevents you from illness, and you save lots of money in the front. We are a system which is a pay for the free services kind of system, where there is very incentive to save the money. It's a driven system where everybody wants to get the maximum for their efforts and talents. So there is no good reasons, or there is not enough reasons for the provider or people who are in charge of the care to reduce the cost, because more volume, more services, more investment, more procedure you do, more you take money home. So there is not enough incentive to reduce the cost of the Medicare care, because everybody wants to make a profit out of it. In a lot of different ways, people say ours is not a medical care industry, but it is a medical industry, just like any industry, even though there will be element of care in our medical system, which is slowly eroding. And our system is basically medical care industry, which is very shameful in my opinion. We don't depend upon social systems. We have a lack of government regulations to prevent the cost. Some parts of the nation, the big hospital corporations are taking over the medical practices, which reduces the available physicians in the community, which causes lack of competition, and that also increases the monopolizing the system, by which the people who are existing, surviving, can charge bigger amount of money, and they can have a better contract with the insurance companies. Everybody wants to have their own pie. It is not only doctors or the hospitals or clinics. We're talking of the medical supplies. We're talking of the long-term care institutions. We're talking of all kinds of people who are engaged in the medical care delivery system. It is very difficult to manage all these people and have incentivized them to reduce the cost of the medical care. So pricing is one of the most important things. Fragmentation. Our system is fragmented because one doctor doesn't know what the other doctor is doing. A lot of duplication of the procedures and the services. We have a lot of redundancy that we can remove from the medical services. So all this thing makes our system formidable, very difficult. And every election time, I remember healthcare has been the biggest priority for the voters. And despite that high priority in the mind of the people and voters, very little have been successfully done. Yes, we have been attempts done, and that is nothing has been really stuck with the people in a permanent way. Now, I don't have enough time to go on so many other stuff that I can talk about the cost of the medical care, but I'm going to very quickly go to what can be done. When I say this, I'm not sounding negative. USA is one of the best medical care in the terms of terminally ill. We have advanced medical devices which can save people's life, and it has saved thousands of lives. We are well known over the world to treat the challenges, and we survive and save many people's lives. People come to USA for advanced medical care. There is no country which can provide advanced medical care as good as USA does. But we are not doing very good job on a day-to-day services. A common illness, we are not doing as good. Which country can you go and you dial 911 and within 5 minutes, ambulance will come in your yard and take you away and provide you the quick life-saving care? Not many countries can claim. I'm talking of even developed countries. Forget about underdeveloped countries. They have no system like that. So 911. And thirdly, ours is a good system because nobody is turned away when the person is requiring terminal or extensive care. We do provide the care, even though we end up with a very large bill or somebody pays a very large bill. But at least for the time crisis, medical crisis, person's health and illness is taken care. And that is a very good thing. Not many countries can claim that kind of asset that we have. Okay, so now let's talk very quickly, go to solutions. Some adults might think that we may not need insurance. Why should I pay for insurance? Very wrong. Even though you may not have any symptoms, you are doing fine. Any medical catastrophic illness can destroy your financial health for the rest of your life. It could be accident, sports injury, or any kind of accident like a neurovascular accidents or a heart attack. It can really push you way behind and you be big trouble for me. To do it is a very, very bad. So having a insurance is a must, number one. Now, it's not easy to find a good health insurance. Finding good health insurance is one of the most crucial management piece for better management of your payment system. Sometimes people go for the cheaper insurance because they cannot afford, they don't feel that they need to pay higher premium. However, you end up getting inadequate insurance, which does not cover what you really should be covered. That is catastrophic illness, a very serious illness which will mean thousands of dollars. Sometimes you pray for this less coverage, less premium, but you end up with very poor insurance guarantees with you. Make that you review your policy carefully. It is surprising that how many well-learned, educated people do not know what coverage do they get. It is complicated instrument. It has a co-payment, deductible, co-insurance, out-of-pocket expenses, maximum, minimum. It is so difficult insurance people to understand, and they make it so difficult for an average person to understand. People like us who are in the medical industry, medical care, having difficulty, because there are all kinds of variety of insurance, and it's very, very confusing. So whatever best you can do to understand what you are covered, how much you pay, and what happens when you have a serious medical condition that needs to be paid. So it's very important to know this is the good insurance company, you have a good coverage, and your insurance needs are fitting what your family and your personal needs are. You don't want to buy something that you're not going to use it, or it is not going to be useful to in the future. So what you need and what you get paid and how much coverage you need is a very complex, difficult equation that somebody has to think and spend some time on it. And that can really, in a long way, help you greatly, very greatly, to understand your insurance as to what you're buying and what are you going to be covered. Half of the Americans have an insurance policy given to them by the employers, and they don't have a choice. But within the employer, there could be more than one plan. It is important to sit down with somebody who knows and can discuss with you about your family needs, your personal needs, and say, what are the different kind of insurance being offered to me? It is very, very important to go through each one of them and make a selection which is more practical, pertinent, and affordable to you in terms of premium, and you get a reasonably good coverage. If you can join the group, it's much cheaper to join the group if you have a choice, like group policies the employer might offer you. If you are individual practitioner, you are self-proprietor, you may not have the choice. I think it's always good for, anyway, I can have association, your professional association, your association in community that you can become a part. Joint premiums are much cheaper than individual premiums. You can adjust your income. Sometimes you are selling out in your income level, and you, by decreasing your income by working few hours less per year, you can qualify for a better coverage, a better insurance qualifications. You should look into that. HSA, health system, is a very high way of thinking, provides a tax investment into healthcare, which can be useful with interest every year, and you can really have a need that medical dollars. HSA program is very useful. You need to understand how much deductible is and how much is your premium. You need to also develop, if you are healthy and you are not expecting your family for catastrophic illness, it will protect you from high bills of thousands of dollars, but you can pay the co-payment and deductible for a routine month-to-month, year-to-year care. If anything else and you don't have children and you take this. You also have a limit insurance, is one of the programs that is available, limit universal option. You can go on a number of Google sites which will help you decide what are the different insurance available for you. And you can make a good selection. Any money, any time spent on this kind of investigation could be very useful in preventing, saving a lot of dollars as a premium and preventing catastrophic medical bill. Now, when you have a medical bill, let me give some other tips because running out of time. If you have a doctor prescribes you medicine, first you need to find out is any generic substitution available or not, because generics are considered to be equally good, not the very best, but they are much, much cheaper, and you can afford the generic brand better than your brand name. The cost of the drugs in this country is going way, way faster than any part of the medical cost. It is absolutely astronomical. Okay, the cost of the drugs is absolutely astronomical. So generic substitution is good, less expensive. You can ask a doctor, yeah, you give me this medicine, oh, very expensive. Is any substitute medicine which can do the same job with a less cost to me? You can ask the doctor. Doctor will be very able to give you. Mail-in orders can be cheaper. 90-day supply could be cheaper than month-to-month supply. So these are some of the things you can do about the cost, preventing the high cost of the drugs. Number two, now cost of going to urgent care or emergency room is very, very expensive. Cost of emergency room is extremely expensive. So it is important that you pay attention to your symptoms and immediately try to think what is going on. So calling your doctor, getting the advice, or visiting your primary care doctor earlier for the early symptoms, which may result into early detection and early treatment initiation, can prevent you from visiting the emergency room if you wait for 2-3 days with the hope that things are going to be all right. Why should I worry about this thing? Sometimes it behooves you to call your doctor, go and visit doctor, and prevent your visit to the emergency room, which will eventually happen, and the outcome could be bad and the cost could be very high. So think about preventive care, prenatal care. Instead of waiting to get anything done in a pregnancy, make sure that you get prenatal care and take care of yourself. You can discuss, there are always a health manager with your insurance company. You can discuss with that person. Nurse is always available 24/7. Any issues, you can talk with them. This is free, it doesn't cost you anything. Call your nurse, call your health manager with the insurance company, free, and you can discuss, even though you aren't sure everything is going to be all right. But just make sure that you go there. Other important thing, take care of your health. Important thing, very important. Exercise, diet, weight reduction, early detection, becoming the member of gym, YMCA. These are the very important thing. These are the preventive aspects, and that is also goes towards management of your health care and how do you wisely and prudently take care of these things. When you have a surgical intervention or procedure, you always ask the doctor, is it going to be outpatient or in the hospital? You will be surprised how much reduction you get by having a procedure or surgery outpatient versus hospital based. Unbelievable. Same surgery, same doctor, location could be different, and you may save up to 50% on your bill. So always ask about, can I have my procedure on the outpatient basis, or should I must go to the hospital? Hospitals get paid much better than the outpatient. So ask for those things. When you have a choice, always try to go to in-network physicians. Try to avoid out-of-network physicians because they are expensive, and insurance company always wants you to go to in-network physicians and providers. So think about those things. Make sure that you annually review your insurance. People say, okay, I have insurance, everything is fine, nothing has happened. They renew for the additional 1 year. At the end of the year, look at yourself, anything happened, call your insurance agency and say, what is available? What is happening? Can I have any other choices? Always review your needs at the end of the insurance term and find out if anything else is available. Can I qualify for a better premium? Is anything given by the employer for another insurance company? Shop around. Shopping around can make a big difference in your premium every day you pay. As I mentioned about HSA, it is important to have some money allocated to HSA account, which will be available. It is not something you want to touch it. You want to just keep it that way. And that can be very, very useful to you when you really need. Now, this is the individual management. Of course, government has a very big part of the health of our country. Medicare as insurance for the people who are 65 and above. Very few people who are disabled can get Medicare in an earlier age, but it is basically for the elderly, and a Medicaid is for the person who cannot afford the routine healthcare, unemployed, and these people they meet the poverty criteria, they get the Medicaid. These two insurances are very rapidly growing up. The enrollment into Medicaid and Medicare is rapidly going. more than 1/3 of our country is almost going to be getting insurance through the Medicare, Medicaid. Government is really on the back to figure out what to do to curtail the cost of the increasing Medicaid, Medicare. Medicaid, so states get involved. And every year, state has a difficult time putting out the budget for the paying the Medicaid, which is difficult to project. You cannot project Medicaid funds because it is out of your reach. Okay, so every state legislators, and Mr. Atri will tell you more about his personal opinion, personal experience. Every state having difficulty providing for the Medicaid outlay beginning of the year. Medicare talks about how difficult it is to continue the same level of care with the same amount of premium. They have made some person like me who are elderly and a Medicare recipient. They have increased the deductible, they have a co-payment, they are refusing certain services, do this and do that. Now we can talk and discuss at length about the universal healthcare, single payer, and all the other stuff we can talk about, but that is not something that I can do it here. My time is getting up. I do want to thank all the audience who are listening to me. This is just a very nutshell, very brief account of how do we manage your healthcare payment from individual family point of view as well from the government point of view. Thank you very much for listening, and thank you, Ray Global Foundation. Thank you.
Thank you. Thank you, Dr. Mehta, for your thorough information to our listeners on managing financial expenses for healthcare services. And that's right. A healthcare crisis have both immediate and long-term impacts on our personal financial management. A survey says that 3 in 10 uninsured adults in 2019 went without needed medical care due to cost. Americans pay almost 4 times as much for healthcare services as citizens of other developed countries. So if you are not in the habit of tracking spending, I would like to suggest to our viewers, I would like to suggest them that some tools are available online, like Spending Tracker, to assist in reviewing your spending, and other is the Prioritizing Bills on a website called www.consumerfinance.gov. Is the website where you can have that tools, and you can manage your finance at personal level over there. The high cost of healthcare affects everyone, sick or well. We know that. It has depressed individual spending power for the past few decades. Salaries for American workers have risen, but net pay has stayed the same because of increasing charges of health insurance. COVID-19 has increased pressure on our highly complex and expensive healthcare system, making it more urgent to lower costs. So today, tightening up on overspending is urgent to help stretch medical and hospital resources to control COVID-19 too. So Representative Autry, could you please let us know that what can the government do from a legislative point of view to protect people's medical finances, and what kind of policies a state government can enact so that people can feel protected in a devastating health crisis?
Well, thank you very much, Deepika, and I certainly appreciate the opportunity to be with everyone this evening and in front of, Dr. Bomfalk and Dr. Mehta. I'm just a lowly public servant. I don't have that kind of expertise to bring to the table. But what I can tell you is I was just elected to my 3rd term in the North Carolina House of Representatives, and both sides of the aisle have been supportive of expanding Medicaid. The governor has been supportive of expanding Medicaid in North Carolina. Why is Medicaid not getting expanded in North Carolina? And it's just so frustrating to me whenever, I mean, I had an experience last week and I shared with Tara about a woman, 64 years old, receiving $1,164 a month in disability. She had a serious gallbladder incident, had to have operation, and then had to return for antibiotic treatment because she contracted an infection. And she does not qualify for Medicaid because her disability pays her $64 a month over the limit. So she does not qualify. She survives on $1,164 a month. She doesn't have a refrigerator in her home that functions at this time. She relies on the food banks to get by with. So why should somebody who has lived their life, raised a family, been a law-abiding, productive citizen in our society, have to experience this at the end of their life cycle? It's absolutely outrageous. And, you know, I back in March when all this stuff started, and we talked about how what the directors from the North Carolina Department of Health and Human Services came down, and one of the first, if you have any symptoms with a fever or a headache or feel like you're losing your sense of taste or sense of smell, first thing to do, call your physician. Well, guess what? There's several 100,000 people in North Carolina who don't have a physician that they can call. So what is their recourse? I mean, I don't understand why we cannot expand Medicaid, a program that would that we're already supplementing anyway through our federal tax dollars. The states that have already expanded Medicaid are receiving the benefits of North Carolina tax dollars, where North Carolinians are being denied that benefit purely from the cruelty of the leadership of the North Carolina General Assembly. So we also know that Kansas expanded Medicaid this year. So now North Carolina is only one of 13 states that has not expanded Medicaid under the ACA. My constituent who contacted me last week, if North Carolina was to expand Medicaid, she would qualify for Medicaid coverage and would be on a much steadier path for the, sunset years of her life. The most recent census data that we have indicates that almost 1 million, that's 994,000 North Carolina adults between the ages of 19 and 64 lacked health insurance coverage in 2017. That's roughly 1/6 of the population, or 16% of the state's adult population. Now that's far higher than the 7% of adults uninsured in Kentucky, or the 9% in West Virginia where they've expanded Medicaid. And the differences primarily were driven by the Medicaid expansions. So what would Medicaid expansion mean to North Carolina? If we expanded Medicaid this year, by 2022, there would be another 37,200 jobs that would exist across the state simply because of Medicaid expansion. The current estimates also project that an additional federal revenue flowing back to North Carolina would mean $4.69 billion by 2022. And that would be particularly relevant to North Carolina, where 6 rural hospitals closed between 2014 and 2019. Medicaid expansion, it's increased the insurance coverage and reduced the number of the uninsured, benefiting both rural and urban residents and those who are African American, white, and Hispanic. It strengthens access to healthcare services, the kind of preventative healthcare that Dr. Maida was talking about. It increased the low-income families' financial security. I mean, all this is about on how people manage their healthcare expenses. If we were to expand Medicaid, more people at the lower end of the income brackets would be able to access healthcare, and that would improve their financial security in their own homes. Not to mention how it would improve the variety of health outcomes. And it would certainly reduce the uncompensated care costs that, that stabilize safety net healthcare providers, I mean, that's just cost shifting. You know, if somebody shows up in the emergency room and they don't have insurance, the emergency room doesn't throw them out on the curb until at least they stabilize them, and then they let go. But those costs are then put on all of us in our premiums. So what does it mean to expand Medicaid in North Carolina? Well, we know that there'd be a lot of jobs that would come from that. And since there'd be more low-income people who would get health care insurance, increasing health care across the state, the benefits would be broadly dispersed. But what about here in Mecklenburg County? Closing the Medicaid gap would mean approximately 32,300 additional people in Mecklenburg County alone would gain coverage. And why aren't we doing it? That is the mystery that will confound me until I retire from the legislature, because I can hardly think of anything that could be more cruel that in the middle of a national global health crisis, we're not doing everything we can to provide more health care to more people in North Carolina. So I'll shut up for now. Thank you all very much. I appreciate this opportunity and look forward to hearing from the rest of the panelists, and especially Dr. Bomhoff. Thank you.
Thank you.
Representative Autry, you're amazing. Thank you. You're truly a leader to the underserved community for House 100. Thank you for evaluating legislature. Thank you for evaluating legislature that will promote health care and advocates. We must get busy demanding health care to ensure the survival of our people. Dr. George Bomhoff, thank you for being on the show. Please introduce yourself and then tell us the most important thing to know about Medicare for All. I've got my nice, my picture's off. I've got my nice Medicare for All picture behind me that you can't see, but it is there. Also, people are concerned about losing 2 million jobs if we eliminate insurance companies. Can you explain how Medicare for All, how the Medicare for All Act of 2019 transitions workers? It's 2020. Medicare for All Act of 2020 transitions workers? Thank you.
Certainly, yeah, happy to be here. Thanks for asking me. Dr. Mehta did a very thorough job of trying to explain how to best navigate the current healthcare confusion. It's like one of those cornfield maze things. It's almost impossible to figure out the right thing to do. And then Representative Autry talked about how we would make substantial improvement in North Carolina if we expanded Medicaid. But Medicare for All would basically kind of eliminate all those concerns, because it's the solution that would take care of all of these problems that Dr. Mehta described and Representative Autry discussed in one fell swoop. So healthcare is a complicated thing, but then on the other hand, it reduces to real simplicity. And the simplest solution to all of these things would, I believe, lie in expanding Medicare to cover everyone in the country, and expand the benefits and improve the benefits and coverage of Medicare for All, so people wouldn't have these financial obstructions and hurdles to getting care in the deductibles and copays and high prescription costs that Dr. Mehta described. So in very quick form, I'm going to go over what I think are the most important things to know about Medicare for All. First of all, it's the only proposal nationwide that can guarantee health care to everyone and save almost every household and business around 10% on health care costs. So people say, oh, well, my taxes are going to go up. Yeah, your taxes are going to go up, but you're going to have more money in your pocket at the end of the year. Your taxes will go up, but what you're spending on insurance premiums, what you're not getting in wages from your employer, what you're spending in deductibles, co-pays, prescription drugs, all of those costs go away. You pay one tax, which is less than all of that other. So sure, taxes will go up, but your income, what you have in your pocket at the end of the year, will go up. So what's the magic to Medicare for All? How can it do that? Well, it does that by eliminating an enormous wasteful bureaucracy and by making healthcare financing much more efficient. It's just a win-win-win-win-win. There's not one area that's negative about this for the country and for about 95% of the population. Medicare for All would preserve the private practice of medicine and it will give everyone the freedom to choose their doctors and hospital. Most patients right now who have doctors are limited to these networks designed by the insurance companies for a whole lot of reasons. So we don't have the freedom sometimes to choose which doctors and hospitals you want to go to. Medicare for All would provide that. And it's not a government takeover. The private practice would continue. It's a financing system. Ask anyone on Medicare if they would like to go back to their employer-provided insurance that had all of these limitations to it, requirements and rules. Once somebody turns 65, you sign up for Medicare and you're set. You go to any doctor, any hospital in the country, and you just don't have to worry about all these details of selecting an insurance program at the end of every year. It's there for you. The people that worry about this being a government takeover, ask a doctor who he would rather deal with in his daily practice, Medicare, the government program, or all these private insurance companies that require so much time on the computer and so much paperwork. There's statistics that show that on average, every doctor spends between $80,000 and $100,000 per year, every doctor, to hire clerks and insurance agents to deal with all these private insurance companies. The bottom line is that Medicare for All can cut that overhead, that paper shuffling in half, and that amounts to about $600 billion every year, which is much more than it would be necessary to provide health care insurance to everyone with the improvement of prescription drugs, hearing aids, eyes, dental care, glasses. So that's how Medicare for All can work. Another real important aspect of Medicare for All that people don't think about too often is how it can reduce, if not erase, a lot of racial disparities and inequities in healthcare. There are no genetic racial differences in health, only differences in access to care and social determinants of health. And Representative Autry kind of said he doesn't understand why we don't have it if it's an across the aisle agreement and like 90% of the population wants to expand Medicare. I think it's racism. I think unfortunately it boils down to that's deeply embedded in the country. And for whatever reason, some people, well, I think it's power. And some people just don't want to give up the power that would provide all of this benefit to people. And I think it's deeply founded in institutional structural racism. So the other thing about Medicare is it's become obvious that the healthcare is not a free market. And that's why the private competition that we've tried to do up to now with the different hospital systems, different medical groups, kind of competing, it's failed to control the healthcare costs or to improve quality. Healthcare at the bottom is a public community need. I believe it's a right. And it's just like protection of our military and fire and police departments. So I think it ought to be funded that way. Not that the government would run it, but the government would fund it. So we eliminate all this incredible administrative overhead that eats up about 1/3 of every healthcare dollar. 35% of healthcare costs go to administrative overhead, and Medicare for All just cuts that in half. As for your question about the jobs that would be lost, yeah, jobs would be lost. These are jobs in insurance companies. These are clerks and people that shuffle paper and make phone calls, denying insurance claims, denying treatments, dealing with appeals, dealing with lawsuits. It's all this administrative bureaucracy in private industry. Those are the jobs that would be lost. And yes, there may be about 2 million of them. But what people don't realize is how many jobs would be created with Medicare for All. And they'd be created by people who are currently stuck. They're in job lock. They're held to their jobs because of the health insurance. They can't go out and start a business on their own because they can't afford these private insurance premiums. So once they're freed from that, we would have this huge flood of entrepreneurs who would go out and create new businesses. And economists have said that probably 5 or 6 jobs would be created for every job that would be lost in Medicare for All. So that's the short answer. The jobs that would be lost are a drain on the system. We could just eliminate those without being concerned about them, other than for the individuals. But Tara asked about the provisions in the Medicare for All bills called just transition. And there's some huge figures, like 3% of the total cost or $100 billion or something, to provide for job training and replacement of anyone who loses their job in the transition to Medicare for All. So the bottom line is that the Medicare for All answers all the problems. It saves money for 95% of the population and businesses. And it would not harm the economy. In fact, it would probably be one of the biggest stimuluses to the economy that we could do. So I think that Medicare for All is the only way to go in solving our healthcare crisis.
Thank you. Thank you, Dr. Bomfak. Thank you for all your explanation about Medicare for All. And in order to make a difference in the health and well-being of a population, we must understand the burden of all problems and conditions that affect the population, as well as how well our efforts to mitigate these problems are actually working. So we need to make sure that. Thank you. Thank you all our awesome and very knowledgeable guest speakers having with us tonight. And thank you, Dr. Mehta, Representative Autry, Dr. Bomfak, for providing your treasure of knowledge to our viewers. And thank you all our participants for joining us tonight. And please join us again in our next webinar, maybe in December, or if not December, in maybe January, but we are planning to do it in December, and on any other financial literacy related topic. Thank you all. And
a heartfelt thank you to our distinguished panelists. Healthcare is my #1 priority as an advocate. If we could provide more healthcare to our beloved community, it would fix so many problems. Thank you to Raise Nonprofit for hosting this amazing forum, so viewers can learn more of the perils of the healthcare system and what can be done to fix it. Good night, my friends, and thank you.
Thank you very much. Good night.
thank you all.